This patient was referred to me for endodontic treatment of teeth number 23, 24, 25. I presented this case a couple of weeks before, a few days before anyways. When he was younger, someone had thrown a rock at him, and the rock hit his anterior front teeth, breaking him. So he got root canals, and he said a few weeks ago he felt the swelling under those teeth, and went and saw his dentist, and the dentist told him that his teeth were abscessed, and he was referred to me. Tooth number 23 looks fine. I mean, there's decay here, and that post is almost perforated to the outside, but I don't see a periapical lucency here, so that tooth is fine. Number 24 and 25 were the problem. You can see a periapical lucency here and here, and on this radiograph you can also see a missed lingual system. I wasn't too sure about tooth number 24 having a lingual canal, but as always, of course, I always check. No matter what, I always check. And some people ask me, for example, oh, okay, how many canals does this tooth have? And they send me an x-ray, and my reply is almost always is 100. They're like, 100 canals? I'm like, yeah. Assume this tooth has 100 canals until you can prove to yourself that he has, I don't know, 2, 3, 4, 5, whatever. If you go in assuming that a tooth has a certain number of canals, then that's how many canals you find, and then you stop looking. So anyways, same here. I knew this had a lingual system, number 25. I wasn't sure about 24, but of course I always check. And you can see all these prefab metal posts, huge. They're not doing anything. They literally aren't doing anything. I don't know why the dentist decided to put them there, because they're not doing anything. Take a look here. Look how short they are. And again, you can see a periapical lucency here and here. Looking at the obturation and the way it looks, you see how sharp these tips are? I knew that we were dealing with plastic thermophil obturators. So we had the case ready, set up, so we would, as soon as we saw that, I confirmed that these were thermophil obturators. We have our system ready to go, so I can pull them out of the teeth. I have a video on how I do that. You can check it out. You can go to my Instagram, and it's there, or I have those videos posted here on TikTok as well. They're kind of hard to find, I understand, but if you're interested, you can go on my Instagram, DM me, and I'll send you the link. But okay, so take a look here. This is all the stuff I pulled out of the teeth. The prefab metal posts right here, and then the plastic thermophil obturators. This came out of tooth number 24, and this one came out of tooth number 25. Right there. I use ultrasonic to remove these posts, and then I use etch files. I engage these plastic thermophil obturators with etch files, and I just pull them right out. These were the teeth, 24 and 25, and you can see a sinus tract on the labial of tooth number 25 right there. Also 24, no sinus tract or swelling, but 25 definitely there was a sinus tract and some swelling there too. You can literally see the post sticking out of tooth number 25 right there. And of course the oral hygiene is not very good. Patient is aware, and he's motivated. All right, so this is the post-op. We did both of these together in one appointment. I just completed them. I did them in one appointment again. Don't care if there's a periapical lucency or not. Don't care if there's a sinus tract or not. As long as I can get the canals dry right before obturation, I can go ahead and obturate. And I've posted many successful cases where I've done that. One appointment, endo, and have post-ops years later that show that my endodontic treatment or retreatments were successful. Anyways, you can see that's the buccal system of the tooth number 24, and you can see the missed lingual system that we found today. The buccal canal of tooth number 24, the apical diameter was large, so I placed an MTA plug. So this is white MTA here. The lingual system was fine, the one that we located that was missed originally. I obturated that with MTA along with the rest of the labial canal. So this is MTA, that's gutta-percha, and that's gutta-percha. That's the missed lingual canal of tooth number 24. So tooth number 24 did have a lingual system, despite the fact that we couldn't see that on the radiograph, on the pre-op radiograph. Look at tooth number 25. Let me show you a different angulation of tooth number 25. And here it is, and in this angulation, you can appreciate the missed lingual system. So number 25 also, as we had suspected, had a missed canal there, and you can see it in this x-ray radiograph, PA. Anyways, everything went well, so we had everything planned, and with how to remove posts, how to remove these plastic thermofill obturators. What would we do if we found out that the apical diameter is 50 or larger? Everything is already ready to go. There is no second guessing, and that's because, of course, I have many years of experience as an endodontist. I've done thousands of these cases, so I hope that one day you get to this point as well, that you just everything's automatic, or you've trained your assistants and they know exactly what they're supposed to do, and everything is ready to go. There's no fumbling, there's no, oh, let me go look for this or look for that. We talk about our cases before we do them, so everything is ready to go. We know what to expect. There's no unexpected. We usually very rarely say, oh, I'm surprised. We already know what we're getting ourselves into, and that comes with experience, knowledge, and tons of training and background and what have you. But as you can see, everything went beautifully. We went ahead and temporized the teeth and referred the patient back to his dentist for the permanent restorations.